Hello, my name is Dr. Hilary Jericho. I'm a pediatric gastroenterologist, meaning that I work with children and their parents to help with problems involving the digestive tract. And today, I'm here to help you. Gastroenterology focuses on everything from your mouth to your anus. And if you giggle at the word anus, well, there's a lot of giggling in store for you. Because today, we're going to spend the next 20 to 30 minutes talking about your kid's poop. One of the most common things kids come to see me for is constipation. This is when your child has problems with either not pooping enough or having very large, hard poops that may hurt to pass. There are so many reasons they can have constipation and so many different ways to try to work through it. While you or your child may think that you're alone out there battling this, trust me, you are not. Currently, constipation accounts for 3 out of every 100 pediatrician visits and nearly 1 out of every 4 visits to a specialist like me. Even one of my very own children, Bryn, who you will meet later, suffered from constipation. But you know what? We worked together as a team, and she is doing so much better now. It's really important to take care of constipation early, or believe it or not, it can lead to problems even when you're an adult. So, during the next 20 to 30 minutes, I want to cover a few goals. 1, I want to help you understand what causes constipation. 2, I want to discuss why your child may have constipation. 3, I want to teach you about the possible treatment options for constipation. And 4, I want you to understand when it's time to go see a specialist. This slide shows an overview of the topics specifically that we'll be discussing today, including 1, how does the machinery work? Or an overview of your digestive tract. For example, how many poops per day are considered normal? Is your child constipated? What should your child be eating? An overview of what a high-fiber diet is. And what is happening in the bathroom? The second portion of this video will cover stool withholding. For example, methods to break this, toilet sitting, medication options, what is fecal impaction, and what to do when all else fails. So feel free to view this video any way you choose. If there's a particular topic that you're most interested in hearing about, feel free to move ahead to that topic or watch the entire video from start to finish. So go grab some high-fiber foods like apples or popcorn, plenty of fluids, and sit back and enjoy this video. Before we jump into the topics of what causes someone to be constipated, we need to first understand, how do we have normal poops? So let's start with the basics. To do this, my buddy Erwin here is going to help us demonstrate this. Erwin, do you smell that fragrant, delicious smell of high-fiber foods around us? I do. Ah, popcorn, yum. So you smell that delicious scent of your high-fiber foods. Your mouth starts to salivate. Your stomach gurgles. You want to eat. You place that delicious food into your mouth and you start to chew it. And then you swallow it. But you may wonder, where does the food go from there? Erwin's here today to help us with that. Erwin, let's see what's inside you that helps us digest our food. There's your belly. And there's your digestive tract. What that consists of is your feeding tube, the esophagus, your stomach, your small bowel, which makes up about 20 feet in length, then your large intestine, which goes all the way down to your bottom. So that food leaves your mouth and enters your feeding tube, or the esophagus. It makes its way down and into the stomach. Once in your stomach also starts to move, pushing that food back and forth and breaking it into even smaller pieces. After your stomach breaks the food down to teeny tiny pieces, about the size of the tip of your pencil, then the food starts to move into your intestines. So you have 2 sets of intestines. The first part is called the small intestine and can be as long as 20 feet in a grown adult. That's 3 times as tall as most people. The small intestine absorbs all the nutrients that our body needs from the tiny pieces of food. So here you see it making its way all the way through that small intestine, down, 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 all the way down. Then what's left of that food moves into the second part called the large intestine, or your colon, which can be as long as 6 feet in a grown adult. The colon is responsible for absorbing most of that water from the food. It makes its way all the way down to your very, very bottom. And then what's left from the food, that's what we call poop. At the very end of our colon is a portion called the rectum. It has a small muscle called the sphincter. And you may not realize it, but this is the muscle that you use to hold your poop in until you're ready to go potty. Most of us like to release our poop in the potty. Babies with no control over their sphincters may go in their diapers. Some adults lose control over their sphincters and use a diaper too. And we all know that bears poop in the woods and birds poop on all the clean cars. Believe it or not, the very first step towards pooping is putting that first bite of food in your mouth, swallowing it, and that entry into your stomach. It's here in your stomach that all that magic begins. All of our bodies have a natural response to when we put food in our mouths. It's called a gastrocolic reflex. What this means is that when the food enters the stomach, it causes it to stretch, and our bodies then naturally send a signal to your bottom to empty. It's this signal that causes most of us to want to go use the bathroom to poop. We sit down, we give a push, that sphincter relaxes, and out comes the poop. You may not need to go to the potty right when you're eating, but typically within an hour or so after, your previous meal has got to get out to make some room. Almost all children have mastered this by the age of 4. Constipation typically occurs when one of these steps go wrong. This chart lists how many poops per day are considered normal in a child by age. As you can see, this varies during childhood, with more poops per day in infancy as compared to toddlers. In infants, the number of poops per day is highly dependent on what type of milk is being consumed. For example, while breastfed infants tend to have more frequent, softer, and yellow poops during the first 3 months of life, formula-fed infants may only have 1 or 2 per day on average. This can change by a few months of age, though, as breastfed babies can be exceptionally good at absorbing breast milk, leaving very little behind to form poop. Often, a good rule of thumb for breastfed infants is to monitor the quality of their poop over the quantity. A happy, healthy, thriving breastfed infant may only poop once every 1 to 2 weeks. But so long as this is soft and easy to pass, this is not considered abnormal, as they're likely just absorbing so much of that breast milk that it's leaving very little behind to form poop. So the next natural question is my child constipated? To help better define constipation, a set of guidelines called the Rome 4 criteria have actually been established to define constipation. They're rather long, so here are my cliff notes on what it says to better understand if your child has constipation. Your child likely has constipation if they have 2 or fewer poops per week, at least 1 episode per week of poop leakage into their underwear pull-up after being potty trained, a history of retaining very large, hard amounts of poop in their bottom, a history of showing signs of trying to withhold the poop, a history of a painful or hard poop, a history of large diameter poops, which may obstruct the toilet. Another way to look for constipation is how the poop looks. This chart, called the Bristol Stool chart, was created to help define what your poop looks like, and if this suggests that your child may or may not be constipated. Types 3 and 4 show and describe what a normal poop should look like. Types 5, 6, and 7 describe what a poop will look like if your child has diarrhea. Finally, types 1 and 2 show and describe what your poop looks like if you or your child is constipated, including separate hard clumps or a lump and sausage-like hard stool. So, if your child fell into one of these 2 categories, then what went wrong to cause this? There are many things that can lead to constipation in children, but the number 1 reason is what we call functional constipation. The most common reasons for functional constipation are either that their diet is lacking adequate fiber and fluids, or that your child is trying to hold their poop, probably because they passed a large hard poop in the past that could have caused pain or bleeding and led to fear that all the future poops were going to hurt, leading to subsequent withholding. Unfortunately, unlike adults, children don't always have the best reasoning skills. If we have a hard poop, we realize that most likely eating a little more fiber and drinking a little more fluids is going to help the problem. Unfortunately, when kids have a hard poop, their minds instead say, wow, passing that poop really hurt. Solution? I'll just never poop again. Problem fixed. As I'm sure you've already realized, given that you are watching this video, that solution never works. While there are other reasons for constipation in children other than functional constipation, this is certainly the most common reason for it, and therefore will be the focus of this video. If your child's constipation fails to improve following the recommendations made in this video, though, it is very important that you take your child to see their pediatrician for further evaluation. There are a few questions you should be asking yourself to better understand, why is my child constipated? 1. Is your child truly consuming a diet high in fiber and fluids? 2. Is your child following the steps of proper toilet sitting? 3. Is your child showing signs of poop withholding? And if so, how do you help to break these? And 4, are there any signs that maybe something else is being missed? We're going to go through each of these main areas to help give you some ideas. All right, now let's start with what your child is eating and discuss if your child really is consuming enough fiber and fluids in their diet. I'm sure you've heard the saying, garbage in, garbage out. This is kind of the same thing, except in this case, with the constipation, the garbage doesn't come out. It just kind of gets stuck. To keep things moving through the digestive system, your child needs a diet that's both high in fiber and fluids. So let's start with the basics. What is fiber? Fiber is a non-digestible carbohydrate, meaning it's not absorbed by the intestines, and it comes from plants. It can help the body in many ways, even beyond helping with a constipation. 1, it slows the way the stomach empties, and it helps you to feel full longer and quicker, and sometimes can help with unwanted weight gain. 2, it slows the absorption of fat and cholesterol, which can help older people to reduce high cholesterol. 3, it improves the bulk and softness of a poop. It relaxes the intestine, and it increases the speed in which that poop moves through the intestines, which helps with constipation. Fiber works by attaching to the liquids that you drink, helping them to hold that water inside the intestines as opposed to absorbing it, and it's that which helps to soften your poop. If there's no water, the fiber mixes in with the poop, but there's nothing to hold on to soften it, and you actually bulk the stools. You don't soften them, it just makes them bigger and harder, which can straight up hurt. So one of the keys to helping a person treat their constipation is to not only add fiber to the diet, but you need to add fiber with water. So your next natural question probably is, how much fiber per day do I need? The amount of fiber and fluids that a person needs is determined by their age, whether they're a boy or a girl, and how active that person is. As most infants consume predominantly breast milk or formula, most recommendations for how much fiber is needed actually starts around 1 year of age. There is a fancy equation that was created to help determine how much fiber is needed in one diet, and the results from this equation are shown in this table. Everyone is a little different, so I do typically recommend shooting for a goal within 5 grams of these recommendations. So for example, if you're a 2-year-old child, shooting for a goal of 14 to 19 grams a day. But if you're a 12-year-old girl, shooting for a goal of 21 to 26 grams per day. Okay, so we now know how many grams of fiber your child needs to eat each day, which is great. But you may be scratching your head as I'm speaking and showing you this diagram and wondering, what on earth does that actually mean? And how does my child consume that much fiber? The next series of charts behind me will help to further answer this question. And on the subject of all these high fiber foods, I am feeling very hungry. I wonder if I can find some sort of high fiber food option around here for me. Look at that! An apple, delicious, and some high fiber carrots. Yum, yum. All right, I'll also quickly show you these charts and to help you to learn how to read them and understand them. But feel free to take pictures of them as well, as I will be going through these quickly, and then you can review them at your own time and pace. So what you'll see in each one of these slides on the far left column is the food item. These are all high fiber foods. In the middle column, you will see the quantity of that food that you would need to eat in order to get the number of grams of fiber displayed on the far right column. We will now show you a number of different slides demonstrating different high fiber foods that you can include in your diet. Should you find that no matter what you do, you just can't seem to get your child to eat enough fiber each day, there are over-the-counter supplements that can help. While you see a few fiber supplements displayed on this slide, there are many, many more options as well. My goal here is to not directly promote or support the use of any of these brands specifically, but I just want to show you what options are available. Using one of these or any similar over-the-counter supplement is also an easy alternate way to add in additional fiber to your diet each day. As discussed previously though, this is only half the battle. The last dietary requirement to help produce soft stools is adequate water intake. Fiber in your diet or the use of laxatives such as polyethylene glycol or Miralax work by attaching to the water molecules. When these foods and medications are taken with plenty of fluid, they hold onto that water and help to make your poop softer and less painful and easy to pass. Taking too little water, though, is going to produce the exact opposite effect and may simply bulk up your poops and make the constipation worse. Okay, so you're now likely asking yourself, okay, well, how much water is enough? The following chart lists the recommendations per age of how much water or liquid equivalent that a person should consume per day. On the far left column, you'll see the child's age. In the middle column, you'll see the recommended amount of ounces of water per day. And then on the far right side, you'll see what that means in cups. So now we have covered the topics of how to make your child's poop soft and easy to pass. But what do you do if we're already at a point that your child has previously passed a large, hard poop that hurt to pass and is now afraid that it will continue to hurt and is working to withhold their poop? As stated previously, young children do not have the maturity to reason out that if the poop hurts to pass, then do things to make it better. They simply equate dry, large, hard poop equals pain. Therefore, logically, I just won't poop ever again. Yes, this sounds ridiculous, but this is how young children's minds work. So if you are seeing your child holding onto something in a corner, turning red in the face, straining, and clenching their buttocks, this is them trying their hardest to keep that poop from coming out. Oftentimes, this may actually look like they are straining to poop, but alas, this is often their exact opposite intention. For this portion of the video, I've invited my friend Bryn Jericho to help me out. Bryn, can you please come in and say hello to our friends at home? Great. Can you say hello to our friends at home?
Hello.
Wonderful. So Bryn's going to demonstrate what you might be seeing at home when your child's working to withhold their poop. Bryn, can you show our friends what this might look like? Remember what we talked about? Yeah. And then you squeeze your butt, right? Because you're trying to hold in the poop. Oh, good job. Perfect. All right. Thank you so much, Bryn, for helping us out. I'm going to catch up with you a little bit later, okay?
Okay.
Why don't you head off and I'll meet you for lunch in a little bit. Thanks. Bye. Pain is not always the only reason that your child tries to hold their poop, though. Additional reasons may include 1, a fear of pooping in public, such as school or public places. 2, inadequate time to sit and poop, such as that at work or school or social commitments. Or 3, that they're too distracted to poop because potentially they're overly focused on video games, the TV, computer, a current activity, or playing with friends. So what can you do to help eliminate these behaviors? Here are ways to work to break stool withholding. 1, implement a plan that will lead to the passage of softer, more frequent, and less painful stools, such as a high-fiber diet with plenty of fluids, or use of medications. 2, work to eliminate fears surrounding public poops, such as working with a therapist to explore this fear further, or having your doctor provide a note that allows your child to use a more private bathroom. 3, place an emphasis on the need for frequent breaks from their activities to try to poop, or whenever they feel the urge to go. Additionally, with the younger children, it's especially important to place a positive twist when encouraging them to poop. As frustrating as this process is, try not to yell at your children or scold them. Lay out what the plan will be from the start and stick with it. Consistency is key. Bring attention to their withholding behaviors and make comments such as, "Sweetie, are you trying to hold in your poop? You know we don't hold our poop in, as this is going to make our tummy hurt." It's very important to let your poop come out so we don't get sick. Then kindly encourage them to try to sit on the potty or try to poop in their diaper or pull-up. Our next few slides will cover interventions to help with pooping, including 1, toilet sitting, 2, distraction techniques, 3, using the correct muscles to help us poop, and 4, positive reinforcement. We will start with toilet sitting. As we discussed previously, we all have a reflex called a gastrocolic reflex. What this means is that when your stomach fills with food, it naturally sends a signal to your bottom to empty, to make room for the new food that's been eaten. Most of us eat a large meal at some point, and within an hour or so, we're going to have the urge to poop. This should hold true for just about everyone. So we can use this knowledge to help our children have the most successful poops possible. Therefore, if you want to be most successful in regulating your child's poops, it is important not only to have them take intermittent breaks from what they are doing to poop, but also to encourage them to try to poop at the best times, which is after meals. Typical recommendations are to have your child attempt to sit on the toilet and try to poop at least 3 times a day after meals. This should not be for a lengthy amount of time, maybe 10, 15 minutes or less. If no poop comes, then you should leave the toilet and try again later. When you're on your way to the bathroom with your child, try to create a pleasant experience for them. Take the pressure off. Help them to feel relaxed. Discuss how relaxing the bathroom is, how easy and painless it's going to be to pass that poop, and how great their belly is going to feel after that poop is out. Now I'm going to take a quick break and meet Bryn for some lunch. When I return, we'll meet you in the bathroom and see how good our gastrocolic reflexes are. Stay in the bathroom with them and sit on the floor. Be as encouraging and supportive as you can. It's not simply enough to sit on the toilet, but it's also very important how you sit on the toilet and what you do when you sit on the toilet. While I must say the toilet was a simply wonderful invention, and I'm certainly not going to knock it, it doesn't always put you in the best position to have a successful poop. If you think of our ancestors before the invention of the toilet, they didn't hover in the air to poop, they squatted. That is because squatting puts you in the best position to have a poop. Thanks, Bryn. For that reason, doing things to help your kid get into the squatting position is best. Britt and I are showing you right now what it looks like to be in a squatting position. And for the younger children who might not be able to squat on their own, you can pull them into your lap, like Bryn and I will show you. Good job, Bryn. Come take a seat in my lap. And you can help them by pulling their legs up into their belly, like this. Bryn, isn't this comfortable?
Yeah.
Yeah. All right, Brinny. Next, do you want to come take a seat on your potty? We'll lift it up for you. Wonderful. Great. Let's show our friends how you sit on the potty. Good job. Isn't that so comfortable? Yeah, wonderful. For the larger children who want to use the actual toilet though, you want to do things that help pull up their legs. Having their legs dangling from the toilet is not ideal and actually can make it pretty hard to successfully poop. For that reason, putting something under their legs, such as a high stool, will bring their legs up and closer to a squatting position, which will greatly increase their ability to have a successful poop. I'll show you how to do this now. While Bryn is demonstrating on the little potty, I'm going to demonstrate on the larger potty. Their knees should be above their hips. Their back should be straight. Bryn, can you get your back straight for me like me? Perfect. And have them lean forward slightly. Can you put your elbows on your knees and lean forward slightly? Hands can be placed either on the toilet seat or like we just said, you can rest your elbows on your thighs. Have them do their best to relax. Bryn, do you feel nice and relaxed?
Yeah.
Perfect. All right, so now you must be thinking, smooth sailing, right? Still not quite yet. Not only do you need to have an ideal position to have a poop, but you also need to take the correct actions too. Who thought there could be so much that could go into pooping, right?
Right.
How we strain and breathe is exceptionally important to the success of a bowel movement. There are two approaches that can be taken here. One for the younger children and one for the older kids. And this brings us to our next two topics, distraction and using the correct muscles to help us poop. Helping to distract your child from any fear they may have surrounding pooping is very important. You can either try some distraction technique of your own, or what I really like with the younger children is having them blow on a small deflated balloon or a straw with clay or Play-Doh plugged into the end. These tools will help to not only distract them from the process of pooping, but also helps them to use the correct muscles to poop. Your child's going to need to tighten their abdominal muscles and their diaphragm while simultaneously relaxing all of the muscles in their pelvis or the butt, allowing everything to relax and the poop to come out. For the older, more mature children, the term used to describe this is diaphragmatic breathing. What this term involves is taking slow, deep breaths in through your nose, allowing your abdominal muscles to expand outward, and then slowly exhaling that air through your mouth, allowing for your abdomen to fall back inward. This should be done in a relaxed and gentle way, not forceful, while trying to think of very relaxing thoughts. For the younger children, diaphragmatic breathing can be achieved using these tools, as most of the younger children aren't necessarily going to understand these instructions. While your child is sitting on the toilet, hand them either the balloon or the straw, and have them work to inflate the balloon or blow the clay from the straw. Have them try to do this every few seconds for a few minutes to see if this helps them to poop. Bryn and I are going to demonstrate this now. All right, Bryn, while you're on the little potty and I'm on the big one, let's try to blow into these together. Which should we start with, the balloon? All right, so we blow, and then we relax. Good job. Should we try that again? Okay, blow, and then we relax. Good job. You're doing great. Are you also noticing how relaxed your butt feels? Almost like it's sagging down into the toilet. This is so easy, isn't it, Bryn?
Yeah.
You're doing a great job. Should we try real quick with the straw too and see which one we like better? Okay, let's try to blow that straw. And then relax.
I got it out.
Oh, okay, we'll have to do yours again. You're too strong. Here, you take mine then.
Okay.
Perfect. All right. And make sure to let your child know continually that when that poop finally comes out, it's going to be so easy. Oh, it's okay. And they're going to feel so relaxed, and their tummy is going to feel great. All right, Bryn. And every so often, it's also good to make grunts and groans, because that also helps to use your diaphragmatic muscles. All right, Brinny, should we try to do some grunts and groans too? Good job. So 1, 2, 3, ready? And relax. Let's try again. Ready? Good job. That's wonderful. And you can keep repeating this every 15 to 30 seconds until your child's able to have a poop. But if nothing happens, no big deal. Be upbeat about the experience. Let them know it's no big deal that the poop didn't come out, and they can try again later. Be patient and don't stress. If you stress, then your child will stress, and that's not what we want. Okay, Bryn, thanks so much for your help today. Should we see if you were able to have a poop? Yeah? All right, let's take a look. Oh my goodness, Brittany, look at this, come here. Great job. What a nice, soft poop. Did that hurt at all to pass?
No.
No? Was that so easy?
Yeah.
What do you want to tell our friends at home?
I love pooping.
You love pooping. Big hug. Great job. All right. Okay, so now we're close to the finish line. The last step in the process of pooping is what type of reward do you want to provide for their successes? The reward can be anything from a simple hug and kiss to a vote of confidence to an actual treat or prize, and this is entirely up to you. Any type of positive reinforcement, though, will make the child feel better about the process and hopefully help to move the process forward. Star charts are always an easy thing to do and help to build the excitement and magic for your child. Hey, Bryn, do you like star charts?
Yeah.
Yeah? Want to show our friends at home how a star chart works?
Yeah.
All right, perfect. Do you know where the star chart is in here? All right, let's come over. How many poops have you had and how many stickers have you gotten so far? 3. And do you remember what happens when you get your 4th sticker?
No.
No? You get a prize. So let me pull out the stickers. Do you want to put on the next sticker? Okay. Any one you want. You want to do the green one? Good job. I'll take that back. Go ahead and put your sticker on the star chart. And let's count together. How many stickers is that? 1, 2, 3, 4. So that means you got a prize today. Do you want to look at the audience? What did you tell me? What kind of prize did you want for
A Hatchimal.
a Hatchimal? Guess what I have today?
Hatchimal.
A Hatchimal, because you've done such a good job pooping. You can make a star chart at home. You can either do it from scratch or you can use a calendar sheet similar to the one that I would do. Let your child know ahead of time exactly how many stars they're going to get. That's going to allow them to have their reward. Bryn and I had decided on 4. So we had 1, 2, 3, and at the 4th one, we knew today was the day that she got her reward. So this is how you can make a star chart at home. I'm not going to go into great detail about the medications available for constipation, and will only provide you with a brief overview of these options. If your child's constipation is beyond the basics and not able to be controlled with an increase in the fiber and fluids in the diet in addition to proper toilet sitting alone, then you may need to discuss next steps with your pediatrician and discuss whether a referral to a pediatric gastroenterologist is needed. Make sure to talk to them before using any medications for the constipation. While there are many medications that you could use for constipation, most of them do fall into one of 3 categories. The first one is osmotics. These are medications that help to increase the water content in the intestines. The second one is lubricants, which are medications that will help to loosen and soften the poop in the intestines. The third one is called stimulants. These are medications that actually stimulate your intestines to push out the poop. Additionally, there are some rectal treatments such as suppositories or enemas. The most commonly used osmotic agents on the market include things like polyethylene glycol, lactulose, and magnesium citrate. The best known lubricant used for constipation is likely mineral oil, which is a personal favorite of mine. And the more common stimulants are medications such as bisacodyl, senna, and docusate sodium. A few take-home points about these medications. 1. For osmotic agents, probably the best known one is something called polyethylene glycol, also known as Miralax. The key to this medication is that it acts a lot like fiber. So remember, you must take plenty of fluids for this to work. Therefore, it is very important to read the instructions very carefully and make sure you always mix it with an adequate amount of fluids. On to the lubricants. As I stated before, mineral oil is likely the most commonly used lubricant and can be given both by mouth or in a bottle and inserted into the bottom, which is called an enema. Enemas also come in other liquids such as saline. When given by mouth, it passes through the entire digestive tract unabsorbed, and then it helps to lubricate and soften the poop, making it easier to pass. Overall, it's very safe, but if the child breathes it into the lungs, it can be very dangerous. So if your child is at all at a high risk for accidentally bringing anything into their lungs, the fancy term for this is aspiration, this medication should not be used. When given by mouth, it can be mixed into any liquid or food, which typically hides the texture and the taste. More or less, this is a flavorless olive oil. So the texture is a little unusual, and by mixing it into a liquid or food, it's going to make it much more pleasant for the child. Last but not least, the more common stimulants, again, are things such as bisacodyl, senna, and docusate sodium. As stated previously, these medications work by stimulating your intestines to help push that poop out. Often, I don't like to start with these, but may turn to them when a child has really severe withholding behaviors, as sometimes it can help to overcome these when the others haven't. The main problem with stimulants, though, is they can become habit-forming, which means that your body can come to rely on them with time. For this reason, I don't often like to use these medications for more than a few weeks to months at most, and then I try to wean the child off of them. There are other treatment options, including a newer technology called transcutaneous electrical nerve stimulation, or TENS, and surgical options, but I'm not going to be covering these within this video. We are now on to our very last topic, fecal impaction. So we have now covered the topics of normal pooping, what can lead to constipation, and ways to fix simple constipation. But what if your child is already beyond that point and things have gotten so bad that you're actually noticing accidental poop leaking into their underwear? If you are seeing this, then your child likely suffers from something called fecal impaction. What has happened is that your child has been working so hard to hold that poop in that it's actually caused the formation of a ball of poop in the very last part of the large intestine called the rectum. It's stretched it out, as you can see here in this diagram. The loose poop behind that ball of poop winds up leaking out by accident and leaks into the underwear. The fancy term for the ball poop in the rectum is called fecal impaction. And the fancy word for the poop leakage is onchopresis. If the constipation has gotten this bad, then the key is to help your child first pass that poop ball. Then you can start to think more about the treatments to help them continue to pass poop easily, including everything we talked about before, including the high-fiber diet with plenty of fluids, the toilet sitting, and again, possibly the use of a medication. If your child is not yet being seen by their pediatrician or pediatric gastroenterologist at this point, it is certainly important that they do so now. Your pediatrician may first try some treatments on their own, such as using a laxative and/or stimulant by mouth, as we previously discussed, in addition to possibly trying a rectal enema from below, again to help soften and release that poop ball that's in the rectum. The key is to clean out that poop ball so we can start fresh. After that poop ball has been removed and your child has started on that combination of a high-fiber diet with plenty of fluids, plus or minus the use of that daily medication, It might then still take a few months to help restore their confidence that pooping is going to be easy and pain-free. For this reason, I'll typically keep my patients on a daily medication for at least a few months before trying to wean them off that medication with the goal that the child's going to continue to have 1 to 2 soft poops a day that are easy to pass and pain-free on the high-fiber diet with plenty of fluids and toilet sitting alone. I hope that you enjoyed this video, found it helpful, and feel better educated about why your child may be constipated and easy steps to improve their constipation. At the end of the day, the most important thing though is remember, if you are not sure, if you have questions, if something seems weird, ask your doctor. Thank you.